Hello, my name is Sarah Thompson, and I'm a third-year pharmacy student at the Ben and Mady Fish College of Pharmacy at UT Tyler, and today I'll be going over clonidine with you. Clonidine is also known as Catapres, Catapres TTS 1, 2, and 3, Duraclon, and Catve. It comes in a transdermal patch, an epidural solution, immediate release oral tablet, and an extended release oral tablet. So clonidine can be used for a few different things. It can be used in attention deficit hyperactivity disorder, or more commonly known as ADHD. It can be used in high blood pressure to help lower it, and it can provide relief in menopausal hot flashes or flushing. So first I'm going to go over the transdermal products with you. First, if you are wearing one, you want to make sure you go ahead and take off the old patch first. You want to wash your hands before and after each use. And you want to put a patch on a clean, hairless, dry, healthy piece of your skin, either on the upper arm or on the chest. And you want to move the site with every new patch. So if you put it here and it's time to put a new patch on, maybe put it on your chest or on the other arm. Just make sure that you alternate. Do not put on skin that is irritated or damaged, and do not put it where the skin folds or where it will be rubbed on by tight clothing. It comes with a patch cover, so if you notice that the patch is a little loose, you can put the patch cover on to keep it in place. Once you take the patch off, make sure you fold the sticky sides of the patch together and throw it away where children and pets cannot reach it. You want to keep using this drug as prescribed, even if you feel fine. And make sure you do not stop taking this medication suddenly without calling your doctor first. For oral products, you can take clonidine with or without food. Make sure you take it at the same time every single day, and keep using the product even if you feel fine. And like I said before with the transdermal patch, do not stop taking it suddenly without calling your doctor first. For the extended release tablets, you want to make sure you swallow them whole and do not chew, crush, or break them. If you have trouble swallowing, talk with your doctor. So it's very important not to chew or crush them, because it can result in a very dangerous large dose, and that could lead to some toxicity. So you don't want to do that. Something to note, it is very important not to discontinue clonidine therapy abruptly. Discontinuing should be done gradually to reduce withdrawal symptoms such as nervousness, agitation, headache, or tremors. And stopping it abruptly could cause something called rebound hypertension, which is an increase in blood pressure after stopping clonidine that could be very severe. So it's very, very important to call your doctor if you're wanting to stop clonidine. If you miss a dose with the patch, put on the missed patch as soon as you think about it after taking off the old one. If it is almost time for your next patch, place the missed patch on. You want to start a new timetable after the new patch is on. And you do not want to take 2 doses at the same time or extra doses. If you miss a dose of your extended release tablet, you want to skip the missed dose and go back to your normal time. Do not take 2 doses at the same time or extra doses. And all other oral products, you can take the missed dose as soon as you think about it. If it's close to the time for your next dose, skip the missed dose and go back to your normal time. And do not take 2 doses or any extra doses at the same time. So some side effects that you should be aware of. The ones in the red box here are ones that you want to call your doctor about right away if you notice them. So those are signs of an allergic reaction, extreme dizziness or passing out, if you have a fast, slow, or abnormal heartbeat, if you have a change in how your contact lenses feel in your eyes, if you have redness, burning, or change in color of the skin, that's with the patch. If you have trouble breathing, slow breathing, or shallow breathing, that's usually with the epidural. And if you feel confused, that's also with the epidural. So if you notice any of these, make sure you call your doctor right away. Some other side effects that you should be aware of are dry mouth, constipation, feeling dizzy, sleepy, tired, or weak. If you have a headache, upset stomach, trouble sleeping, or bad dreams, those usually happen with the extended release Stomach pain, feeling irritable or not feeling hungry. Skin irritation, usually with the patch. And sweating a lot or throwing up or ringing in the ears, and that usually occurs with the epidural. If any of these become to be like bothersome or like affect your day-to-day life, go ahead and call your doctor on those. So some things that you should tell your doctor before starting this medication. Tell them if you are allergic to this drug or any part of it. If you're taking another drug that has the same drug in it. So if you're on the oral Clonidine, you do not want to be started on the patch or anything like that. If you're also taking digoxin, diltiazem, verapamil, or a beta blocker like metoprolol or propranolol, these are all going to slow the heart rate down. And so that's something that we want to watch out for when taking Clonidine. With the epidural, if you have any bleeding problems or if you're on a blood thinner, and if you have an infection where the shot will be given. So if you have any of those, you want to make sure you tell your doctor before starting Clonidine. So Clonidine is a high alert medication. That means that if it's used incorrectly, it could cause significant harm. So it's very important to inform your doctor or pharmacist about all health issues and all prescription, over-the-counter natural products or vitamins that you take. Clonidine should be stored in a dry area at room temperature. And if it's an oral product, make sure that the lid is on very tightly and keep it away from children and pets. Clonidine should not be stored in the bathroom, and do not flush it down the toilet or pour down the drain. Okay, so I have a little quiz to help recap. Which of the following can occur if you stop taking Clonidine abruptly? Is it A, really low blood pressure, B, really high blood pressure, C, really high blood sugar, or D, really low blood sugar? I'll give you a second. All right, and the correct answer is B. Yeah, so really high blood pressure. So that's why we do not want to stop taking Clonidine abruptly, because it can cause something called rebound hypertension. And that's why you should contact your doctor, and they will help you taper off of Clonidine if you're needing to get off of it. So which of the following side effects should you call your doctor about right away? Is it A, constipation, B, extreme dizziness or passing out, C, headache, or D, upset stomach? I'll give you a second. All right, and the answer is B. That's correct, yeah. So it can cause extreme dizziness or passing out, and that's because it can cause low blood pressure. If extreme enough, you may feel substantial dizziness and even fainting. So maybe while taking Clonidine, if you don't already have a blood pressure cuff, you may want to buy one and monitor your blood pressure while you're on this medication. And which of the following is true about the administration of the Clonidine patch? Is it A, if you miss your dose, just put on a patch on top of the old patch? B, if you miss your dose, wait until it's time for your next dose? C, if you missed your dose, put on the patch as soon as you think about it after removing the old patch? Or D, if you missed your dose and you put on a new patch as soon as you think about it, continue with the same timetable? I'll give you a second. All right. The correct answer is C. Great job. Yeah. So you want to, if you miss a dose, you want to put the patch on as soon as you think about it after removing the old patch. D is incorrect because you want to make a new timetable. B is incorrect because you want to put it on as soon as you think about it. And A is incorrect because you never want to put on 2 doses at the same time. Okay, I hope that was helpful. If you have any other questions, there's a link below this video that links to the patient education pamphlet for Clonidine. If that doesn't answer your questions, do not hesitate to contact your doctor or pharmacist with any other questions or concerns that you may have.